Asha Gala, and I work at Ethos Primary Care as a lifestyle clinical director. I would say 1995, around that time was when we gave up dairy product because we were vegetarian by religion mostly. So dairy was the only animal products that we had.
Were you vegetarian from birth?
Yeah.
Okay.
Yeah.
You say mostly. What does that mean?
Oh, you mean for the dairy? Yeah.
Yeah.
Yeah, I mean, that was the only animal food. Occasionally, I guess I must have had a cake, that may have had eggs probably, but never had, that would be very, especially in my young adult life, cake would be the only place that it could have sneaked in.
Prior to going vegan, what kind of led up to it? Were there any seeds along the way, or did it just kind of just happen one day? What happened?
Gosh, it all started because of the visit with Dr. Furman. My daughter had severe food allergies, eczema, all that since she was born, and we were constantly looking. By then, she was around close to 6, and I had already administered to her 2 to 3 courses of antibiotics for her ear infection. And my husband, he has a PhD in pharmacy, he said, this is just crazy, because we were giving antibiotic. One course would end, and then the next, and the next. So I had heard about Dr. Furman was there, and that, a friend had suggested, why don't you go, visit him? So I went with my daughter, and that was the first thing he said, the dairy needs to go out. And that's what, I just mainly did it mostly because we were looking for a solution. I did not want to give her another dose of antibiotic. And the magic is when the first week I gave, stopped dairy for her, not change. The school nurse would still say that her ears were still red. So I would be nervous, call the office, the doctor's office, and and he would encourage me, go one more week. And the third week, and close to the fourth week, I started getting nervous because it was still not clearing up. But it was very reassuring to hear from him. He said, trust it takes time. And it was something about after that, the year cleared up and we were already dairy-free for 4 weeks by then. So we could see the results that we were moving in the right direction. I did not need an antibiotic. Yeah, so that was my eye-opener, especially for my husband also. Yeah.
And then you decided to do it as well.
Yeah, because she was a 5.5, 6. I couldn't see stopping dairy for her and me eating. That was not going to happen to this child. So we were pretty much eating a lot of food that she could eat. We wanted to eat as a family, and we knew that the success would be if we did it together. So that's how we chose. Because of her allergies, she kind of was very understanding that there were that food was causing her illnesses. So she was, of course, it was a big one. It kind of probably, she had so much allergies, it must have bothered her now that I look back, but we gave it up.
Wait, do you feel like it was easy to give it up?
I wouldn't say easy, no, because I had not realized how dairy had sneaked into all our meals pretty much. We use ghee in Indian food for our bread, the rotis. We kind of have yogurt at least once, meal, or buttermilk is a big part. So that was a big realization that it was so much in our daily eating. Yes, we missed it.
In India, do you feel like there's a lot of people who are vegetarian, or do you feel like most people are eating meat? And do you feel like there's a significant vegan population there at all?
Yeah, I think it's picking up. Like if you asked me the same question in 1995, I would still say, so just to give you the context, there's always more vegetarians, right? The way culturally it is more vegetarian based. So, but it included dairy. Vegan, I had not heard the term when I was growing up in Mumbai, people not eating, milk, or, it was always considered that milk was very much needed to be a healthy human being. So I had never heard the term used. Today, it's very popular. It's kind of rising. In fact, there are many organizations, there are meetup groups, so it's on the rise.
But isn't there also a lot of people eating meat too?
Yes, it's weird that when I was growing up, I had not heard about that. The animal foods was not as much. The people were eating, but not as much. Today, I think it's a lot more. It still wouldn't call it yet meat-centric, but the consumption is definitely increased.
Sometimes in my comment section, people will say things like, if vegan's healthy, why is there an increase in diabetes and heart disease in India, for example?
Yes.
Have you heard that?
And that is the pure, I would say, because of the processed foods, because of the rise of processed foods, fried foods. And another reason, when me and my husband, when we were growing up, dairy was not as easily available. We would get ice cream only on a special occasion, on a wedding, honestly. We didn't have weddings every day, but I vaguely remember as a little girl, I knew, if I go to this wedding, I'll get an ice cream, and it was very exciting at that point. So today, people eat it every day, some of them. So I'm just the consumption is far more, the availability is just a lot than when we were growing up. So that was a difference. And of course, the lifestyle is a little bit different now. Back there's more, less movement. And
so it sounds like there's more vegans. It's maybe a term that people are familiar with there, but the vegetarians are probably consuming more dairy than ever. And there's probably more people eating meat than ever.
Yeah, I would say the dairy products is the cheese has really kind of, it's addictive. And it's crazy how much dairy products are consumed a lot. In Mumbai. And the fast foods, the French fries, the burgers, the chips, the potato chips. I don't remember as a child having a potato chip bag. No. So a lot, the cookies, the crackers, all that was, the processed food in general was not available when I was growing up. Right now, it's a huge part. The cakes, the biscuits, the crackers, and Indian food itself. I know my mom would prepare some fried food and, things like that. The consumption now, because it's so readily available now, the fast food Indian food, the fried food, again, that's another big one. The sweet dishes, it's just crazy. The kind of all disease-causing food is available in plenty.
Yeah. It's overwhelming, I imagine. Because, it is here, and it sounds like it's a lot like that there.
And it's sad, right? The reason I feel sad about it is a couple of years ago, it almost broke my heart to hear one of my maid having diabetes. And that was a shock. When I was growing up, diabetes was only among, affluent people, because they could afford all this rich food, right? She used to help my mom a lot, and she always, whenever I go to India, she always comes to meet me. And then she said that she had diabetes, and she knows that I continue to encourage people that eat a lot of fruits and vegetable and, avoid dairy product. And I was explaining it to her, but it's hard, right, at this point. And what I realized is that there's a disease explosion in the population that is financially not as, it's expensive than these medications, and, now they are, diabetes is like exploding in India. Yeah, if you see. Yep.
It sounds like it was hard, going back to earlier when I asked if it was hard to cut dairy out, you said it was basically in everything. Eventually you got away from it. Now, how did you accomplish that? What was that transition like?
We just completely gave up like cold turkey. We had to. It would sneak in when we would go to a party or something, because I was still hesitant to tell people that I was not eating. We were still fairly new and we didn't know. Of course, people knew about my daughter's allergy, so they would not offer, food to her. So that way it would sneak in. But we did transition mainly because we did not want another year infection. So at home, we had cleaned it all up. But it was mostly if we ever went for a social visit, it could sneak in. And I think the bigger picture when it completely got out was when my husband's cholesterol went off the roof. That was an eye-opener. Again, Dr. Furman was, because we went to him because of my daughter. And then similarly, when his cholesterol was high, we went and he said it's the same thing, So that means, of course, we were probably not eating as much dairy, but I'm sure we were eating processed food or whatever. But that was one of the things that may be sneaking in. And then that came off completely because of him.
Now, he said when I interviewed him that he would have a little dairy maybe in his coffee at work or something. He felt like just that little bit was enough to really knock things off.
Yeah. Oh, yeah. It was, I know when people say, I just take a little bit. And he's a perfect example. Even that little bit, the numbers would show up. And when we completely, that's what we had to literally be like detectives. Where is it sneaking into his plan? Why? Why is his cholesterol? So he's he's like very sensitive.
Yeah. So as far as in the house, you had to learn new things, I imagine. So take us a little further back. Okay, I'm not necessarily going out, and those challenges. But in the house, you had to, instead of ghee, did you find a vegan ghee or did you just not use it?
That is true. Initially, when we made the transition, we were trying to kind of, see if we could do, some vegan butter or something. So we were desperately, we really missed the yogurt a lot. Sometime within 2-3 years, I know the coconut yogurt started coming in, or those we started buying. And that's why it's almost like we still wanted to make our food the old way. So we were trying to replace, find. I remember even getting the cheeses that are made of oils and nuts. At that time, I know they had a lot more oil. But of course,
did you learn how to make your own cheeses too?
Now we'll do. My daughter has come up with she'll just crush some walnuts and nutritional yeast and like that type, like a Parmesan, where you can sprinkle. Or Pankaj will come up with a sweet potato cheesy sauce, a butternuts cheesy sauce. So now we've come up. But initially, when we were transitioning, in 1995, one drawback was there were not many recipes. Dr. Furman could just tell me that, just that I couldn't, but there was nothing further. So it was almost like I had to figure it out on my own. I did have few friends who also joined the bandwagon on it, So they were. I had some friends who had allergies. Her kids had allergies, so it was nice to kind of exchange things with my friend.
So they maybe figured out some ways to get creative.
Yeah.
And help you think outside the box, I guess.
Yeah.
So give me an example of what eating was like then. You ate legumes, greens, grains, fruits, veggies, mushrooms, nuts, seeds.
Yeah, all of that. When we just did the transitioning, the amount of leafy greens was less in our eating versus now. Now I think we eat a lot more vegetables. So it was a heavy grain-based plan more when we transitioned, because technically that was...
It's kind of easier, I think. Grains are easier to come by, I think.
Yeah, just make those chapatis and, dal. And that would be the biggest changes from there to now is we've added more leafy greens in our plan.
I think that's a reflection of what I'm doing too. I'm it's a little more work getting the greens in there because you have to go shop for them more.
Chopping, washing.
Well, you have to buy them more because you got to get them fresh.
Yeah.
Like grains and legumes, you
They
can store
stay.
them.
Yes.
Store those.
Yeah.
So whenever I tell somebody like try to give them, encourage them, I'm usually like, you're going to have to shop for greens more, fresh produce more. So that's cool that you're an example of that as well. What kind of legumes do you like to eat? I guess lentils and...
Yeah, we typically, we love, all the dals. That was one, you never appreciate how grateful I am to have learned and appreciate the kind of food we were exposed to, right? A lot of dals and legumes we were already exposed to. I've truly started appreciating that my grandparents definitely ate so much better. And I think whenever the processed food started seeping into our little world, even when I was little, I'm sure there was some processed food that started seeping in. It made me reflect a lot, always saying, yep, because that's the kind of food plan that now me and my husband, we eat a lot more vegetables probably.
Is lentils the only kind of legume that you focus on the most, or do you?
Beans, we sprout also. So sprouting is a big part.
Like what kind of bean?
I would say mung bean is very common. Mut beans are big common. Those two we definitely sprout. And then we do have black eyed peas. Then there are different kind of garbanzo beans, the black ones, the brown ones. There's a lot of variety of that. Soybeans, we don't, edamame is what we eat a lot. The dry soybeans, we have not cooked as much because there's so much other variety. And the lentils, those are the...
And rice, is that your main grain, rice?
Initially, I think rice and wheat were our, when we had started our journey, then I think we started adding quinoa, into our plan. And lately, last few years, we're adding all kinds of millet has become a big part. Pankaj and I are also starting to being aware to eat more locally, because if quinoa is not grown local, we are a little bit conscious about trying not to tap into other cultures, because it has to be transported and, the things that you hear, how, these industries are working. So we're conscious. I'm not saying we're perfect. We're still...
Is that why you didn't mention cashews earlier, maybe?
You mean the nuts and...
Yeah, you didn't mention, when we were talking about cheeses, you didn't mention.
Yeah, you know why? My daughter had allergies to cashew. Cashew was not as much consumed. Nuts were not as, she had severe allergies. I think walnut was initially, that was the first nut we started with her. So
she's okay with walnuts?
Yeah, she's okay with walnuts.
Just because cashews...
Like people use a lot of... to make cheese. I do. I mean,
But it's like a cruel industry, though.
Oh, yeah. I agreed. Yeah, I totally... Now that if you tell me, yes, I would not have it because of that, too. Yeah. I agree with you that...
Yeah, hopefully there's a way around that because they're so good.
Yes.
Kamut?
Yeah.
So, you
all
said
kinds
local
of grains. Yeah,
all
local
grains. If there's a local farro.
Yep. Barley, from the Ethos farm market, we get the oats, the groats. The groats, yeah. So we're very excited about this local grains. So we're really transitioned more. So rice, we'll eat a reasonable amount, but it's not like on daily basis. I know when I was growing up, that was wheat and rice. And of course, bajri, that is, the millets were also a big part when we were growing up. Like in the morning, my mom would make a millet, bread, or for dinner she would make. So millet was a part of our growing up, millet.
And then, of course, a variety of vegetables and I guess some fruits and berries and all those typical things, right?
Yeah.
So no shortage in variety.
No, in fact, there's so much more variety. It blows me away.
Yeah. So cutting dairy out probably just opened up new doors. Now, on an ideal day today, like in this day and time, I think I've got the impression that mostly getting more greens. Is there anything else that you're trying to do different now based on everything you've learned,
Yeah, based on what we have learned, eating a lot of leafy greens, as you,
And sprouting, is that a new thing?
No, sprouting, as I said, it's a part of our culture. My mom and they did it, so it was already
fermenting. What about that?
The fermenting. Yeah, we do have few dishes from south of India. We do enjoy, but it's not that we enjoy, consciously doing it because of the fermenting process. But overall, we enjoy those.
Back to culture, I'm curious. When I was speaking with your husband, he was saying the Jains, that goes back thousands of years, respecting animals, respecting all life, essentially, right? And to me, that's like a form of veganism. Like, so in my mind, veganism goes back like as far back as you can see,
Yeah.
And but now some people will say, well, that's not vegan because dairy, but it was as practicable as possible because of out of necessity maybe, or they respected the animal and they didn't force the animal into existence. It was sustainable. It was based on whatever the animal overproduced or you were able to get without harming the animal or taking away from the animal's offspring or...
Absolutely.
Yeah, and which isn't practical now because there's 8 billion people on the planet, so how are you going to do that, right? But back then, maybe it was a lot more practical. Do you feel like that's kind of... like veganism has always been here, but maybe now...
I would definitely... So what had happened was almost a year and a half ago, I was invited to do a talk, a webinar. It was a Jaina conference. It was online. And I was trying to brainstorm, what should I talk? And an idea came to me. I said, I have friends and family. Why don't I do a survey? It was a Jaina conference. And I said, because... You're absolutely right, because the strongest belief in the do no harm is a big part of Jain religion. Do no harm, don't hurt, in its teachings, very much. So I did like a survey with all the people who follow this religion. I asked them, did they know where dairy products came from and they animals? And my question was, are you aware that that it harms the animals? And many people had a mixed, idea about it. So I kind of questioned a lot, and I learned that you're so right. Jain religion, if you go to see, yes, its teachings are very much where animals should not be hurt. They should be rather, we should all be living in harmony.
Symbiotically.
Yeah.
So it makes sense to me that vegan was coined when it was around the 1940s, because that's when the population probably exceeded a point where it was no longer possible to access nutrients from animals without exploiting them in a harmful way. Then when we became so efficient at growing whole plant foods that we no longer needed to do that. It's then that the term needed to come to fruition. The idea and the intrinsic nature of it, it's always been there, I feel like. I love that idea, because some people say, well, this is a fad diet. This isn't natural. If it's always been there, then it's not a fad. And it is natural, and it is a beautiful thing. And it's cool to talk to somebody who exemplifies that to the core. I don't come across many Jains. I mean, there's only been a few. Now, when you did that survey, do you feel like these people didn't know that they were harming animals, and now that they know, maybe they'll stop consuming dairy?
I think dairy is addictive. It's a very addictive substance. People would have to consciously educate themselves and be willing to acknowledge that, it has a lot of difficult health issues, but it's definitely not in harmony. At least I built a curiosity among them, and I'm hoping that curiosity continues in them, and hopefully someday when they're ready, they may be able to take that step. But now I see that people are more conscious,
When you say it's addictive, I mean, I understand there's theoretically a mechanism there called casomorphine. That doesn't really create any physiological withdrawal. Could it be just a habitual addiction? Like it's just a habit, it's just there, it's just an acquired taste that people don't want to change, right?
I agree. Taste is definitely there, but yeah, it's not in the sense, I would say.
Like you didn't go through withdrawals
No, that.
And you don't miss it now, do you? Maybe?
No, I don't miss it now at all. As I said, remember when we would go to the parties and we would take a bite of it and we would want to take that second bite. We were not able to, because I think that to me is the reason why I wanted to go for that second bite, because of the taste. I don't know whether
could have been a
sugar
social thing though too. Because like if you did it now, do you think that would happen?
Now I can't even.
It'd be gross now.
Now, yes. I always come up with this one story. You know, a couple of years ago, I had gone to, the village where my parents have their home there. It's up in Gujarat. And my mom has a good friend, and she was very excited that, that I'd come over. And she has a cow, and, it's typical village life where they are milking the cow every morning and all of that. She was excited. She said, no, come to my house. And she would always help my mom a lot. So out of love, I said, no, I have to go to her house. And when I went to her house, I had not realized she had milked this cow, and she had made, it's called kheer, where, she had put sugar and some nuts and stuff. And I was like, oh my God, because now where am I going to tell this old woman that I don't take, because she's not going to comprehend. So I had to, this is the reason I tell people, at that point I told her, I said, listen, I will choose how much I want. I have other commitments. So I went, she gave me this big glass. I took a very small cup. I poured a little bit. My husband was like surprised. What am I doing? And then I took those couple of bites. I gave her a hug. I wanted to thank her because it had love. Yeah. Because I think in her head, she said, oh, my friend's daughter is here. And that was the love she showed. And that kind of touched me. I said, you know what? I cannot turn that on. So when I drank it, I did not enjoy it at all. I was so conscious as I was drinking those 2 sips. Okay, it was even just 2 sips. But consciously recognizing, it is not, it's not that you're going to like it right away. Yeah. The sweetness was what was the most taste, but then it left that on my tongue. It left a very sticky. It stayed. I made a conscious effort because of a social commitment, because I looked at it as love or as an accident. We do. Me and my husband have come across many accidents, not realizing. And then
So it's cool that you mentioned the love thing. I'm sure the social pressure is probably the most challenging part about being vegan.
Absolutely. Especially when we started our journey. Now I think everybody's pretty much, they know us, our close family and friends.
And the social part, being friends and family, and just going to a restaurant, dealing with waiters in public. Like Furman, I love quoting him. He said you have to be a leader almost to do this. And it's because of those obstacles, right?
Yes.
Yeah. And it's the expression of love with family. It's like, how do you turn it down? Well, in this culture, it might be a little different. In that culture, what you're talking about, where she got that from. She went out there and milked that cow.
She milked it herself, and she was conscious of that.
Yeah, so there was love through the process. Whereas here, you go to your grandmother's house, and she just got it from the grocery store. So the love isn't the same extent. So but it's still there. She might, prepared this meal with love, and then that's a whole challenge still, even in this culture. But
I think whether somebody buys it from the grocery store or, takes all the effort, I think deep down there's the love. They feel like, a lot of people, when you feed, they feel like you're doing something good for them. It's a culture. I think it's everywhere. People love to feed.
What can they do to overcome this? Because it's like how does a 20-year-old say no, grandma, or 16-year-old or 10-year-old? The 10-year-old might be able to do it easier. I don't know. But I think there's a certain age, as people grow, that where it's like it's too awkward and they don't really know how to.
There are multiple ways. Like, so this, my mom's friend, I don't visit her I saw her after like many, many years, right? But if I had a grandma that I was going to be seeing every day, for example.
Or once a week or whatever.
Yeah. Now I think I would make an effort to sit down and explain them, right? Listen, I have changed. I want to, follow this plan because I want to feel right, and it's my belief, and not that what you're doing, I'm not interfering or I'm not judging you for what you're doing. As long as we can have that kind of an open conversation, and the key is making people feel that we are not better off than them, making them feel more like, I'm just, trying something. And keep making them feel safe. I think the problem comes when somebody else feels judged. I think that's when the tension gets more.
Is that judged too? Like when you're turning it down, like?
Yeah, because it feels of turning it down unless it's not done with an explanation. It's how I'm sure I must have done it, but turning it down by saying, "Ooh, I don't eat it because it's disease causing." Mm-hmm. It's going to hurt somebody right away if I said it like that. Yeah. And it is true, but it can't say the truth right away. I don't know, it may have in past, but now I consciously feel like, they want to feed you because they want to feed you out of love. And if I can rather explain that, hey, I've stopped eating that, and,
I would love to try something else.
Yeah. I think, that would be a much better way, is to telling them rather than every time going to their house and turning down the food. Mm-hmm. And that's not fair also, I feel, every time. But rather if you explain it, then, they will probably be curious and they may have fruits for you. They may have things that you may tell that is easy for them. To do. So I know now when I go to visit my family in India, most of them know that, it's easy to give Asha fruits. Yeah. So that's the way out. Every time I go, I enjoy, or they kind of know I don't have dairy products, so then they'll try not to include any dairy in my meals. And the beauty in India is so many dishes technically are dairy-free. Mm-hmm. And I didn't know until I moved away, right? As I said, I was so much attached to it that I used it, and I think I may have been using it more because that it's healthy and it has a protein and it has a calcium and all. But slowly as I was moving away, it was an eye-opener. There are so many dishes that you can make that are dairy-free. And it was an eye-opener.
Yeah. So I noticed you're 100% plant-based, according to your shirt.
Yes.
Does that mean do you ever like tiptoe around using the word vegan, or?
I do, I am a little, because the term vegan kind of, French fries, potato chips, they are vegan, right? And so I feel like, because I am conscious about fried food, I'm conscious about the oil content, I'm conscious about processed food, that would be the reason I feel I'm not correctly sending the message. But it's so much easier to use the term vegan when I'm eating outside, because people are much more, the animal food is out of the way.
Because plant-based could include eggs or dairy.
I wouldn't say people are not, even if it's plant-based, they're not really aware. What does it mean? They don't know. They'll be like, what does it mean? What is plant-based?
And sometimes food that says it's plant-based has dairy or egg in it. So, but then now as to your point though, I feel like I need to defend veganism.
No, I'm not saying.
Let me do it though.
I agree.
The reason why is because humans are animals, right?
Yes.
And we don't want to hurt any animals, including humans. So if French fries are bad for humans, then it's less vegan to me. To me, processed foods are just corporations exploiting the term vegan, right?
Agree.
And so if whatever's healthiest for a human to eat would be probably the most vegan thing to eat, to me. That's how I get over. That's how I
No, you do have a good point. Definitely. I think the vegan term, it's almost like it got abused in a way. So I'm with you. Now I feel like it definitely explains it well.
Yeah, I mean, I guess what you're referring to when you say abuse, maybe animal rights activists maybe being a little too radical and people taking that and thinking, oh, I got to be radical and I don't want to be radical. Maybe, is that kind of what you mean? Or the negative connotation that developed out of that?
I think the more so is the processed food is what, because if you see when veganism came up, the diseases causing did not decrease as much, right? There was a lot of exploitation where the processed food moved from one ingredient to the other. It was still a processed food, whether the cookie, it had butter in it, but now it has a vegan butter in it. So I feel like, and that was the advertisement, it's vegan, but then it's truly not yet healthy, right? So I guess I'm on my journey where professionally I encourage people that we all are meant, we all have the capability of reducing our morbidity period. And what I mean by that is wherein our quality of life can be amazing few days before we are ready to die, few months before we are ready to die, versus having this long period of, diseases, chronic illnesses, or, being morbid, like it's almost like I start hearing many friends and starting to have, a little bit of health issues, and they're saying, oh, it's my age. And then it creeps up and it creeps up, and so that's I think I'm very passionate. I feel like there is an opportunity for us to be able to chop wood few months before we are able, not that I can chop wood, but I'm just saying that the energy that we all can have, we could. So that's where it's not the age.
So what I'm hearing you say is maximize health span.
Quality.
Yeah.
See, I mean, the pharmaceutical industry, they have extended the health span with a lot of
you're talking about lifespan.
Yeah, the lifespan, they have increased it, but it's not the quality.
Yeah, the quality comes from health.
Yeah.
So to me, the quality is the health span, lifespan is the quantity. So quality, quantity, I don't know. That's
yes.
So you do lifestyle medicine? Or are you?
I work with...
You're a nutritarian, I hear.
I started, yes. Yes, my journey, as I said, I definitely give credit to Dr. Furman to introducing us into this world.
Are you a certified nutritarian?
I was one of the he had the exams that, I was one of the second person who cleared those exams. It was in 2009. That's when he started. Yes, I can definitely say I was one of those where he started it. Nice. I did get my certification. And I definitely feel like his standards were pretty strict in really educating and talking about nutrition, building more clarity about what micronutrient, to value that more, focusing more on the micronutrient aspect.
Do you have any other, qualifications like that or whatever?
Yeah, so as undergrad and all of that, I started as a system analyst, but this was my first exam that I started off with giving Furman's. And then I ended up doing the health and wellness coaching certification through the National Medical Board. I think they started off in 2017.
Health and wellness certification? Health
and wellness coaching certification.
Oh, cool.
Yeah.
And that's through what organization again?
It is, again, the Medical Board, National Medical.
National Medical Board. So if somebody wanted to be, I guess, a nutrition coach or something along those lines.
Basically, the health and wellness coach, if anybody wants to do, they have amazing, you have to go through a curriculum. Many colleges are offering that, or there are programs, a year program. And then, you kind of go through, you have to coaching, as a part of that.
Like an intern kind of thing?
Yeah, interning. And then you have to sit for the board.
And then,
so it is, it requires a licensing. So I have like every 2 years I have to renew CMEs, all of that.
Wow.
It's a pretty intense. I'm very, and I think the curriculum is very, very beautifully designed by all the people that put together this coaching program.
Like, in lifestyle medicine, you have the 6 pillars. So I guess you learn about nutrition and other behaviors, sleeping, stress management, whatever, exercise.
I think this is more of motivational, inspirational, how to motivate.
Meet people where they're at.
Meet people where they are. That's all it is about. It's more where, there are some difficulties many people have. And when I talk to them, I'm able to know whether they are contemplating or whether they are ready, right, to be on that journey, or they're already there and they need additional support. Being able to identify whether somebody is in those stages, the stage of changes, and then meet them where they are based on that.
What a layman might say, go after the low-hanging fruit.
Yeah. Absolutely, absolutely, yeah.
So without having to endure the rigor of your curriculum, is there like a little nugget you could give us on how to deal with non-vegan? Like when to deal with them, who to deal with, and who not to deal with kind of thing?
You already used the term. I think if we can bring about the mindset that meet where they are, and to add, I think I am a little bit lucky in that sense. I also, in 2014, I had taken a mindfulness-based stress reduction program, just out of curiosity. And that was like an eye-opener. That was my first introduction to mindfulness. And then that inspired me so much, so I ended up getting certified for that too.
And what's that called?
Mindfulness-based stress reduction program certified teacher. So
a long one.
I know. I started it learning through the UMass University, and now I'm doing it through the Brown University. They have an amazing program there. I'm on my last, just ready for my submission. I just have to do one retreat, and then I should be. So getting back to your question, how do you meet people, when their beliefs are a little bit different than... So I think, again, what I've really seen is compassion, I feel, is just like, when we become vegan, people, who do become vegan because they don't want to hurt the animals, or, that's a compassion. I think if we apply that same compassion to people who are not yet ready, it's because... it's just that they are not ready. It's not registered to them that they're hurting other animals and all. So the ignorances they have, and if we can see the ignorances in other people, I think you're automatically able to walk away with not getting as irritated. And then there is a deeper wisdom within us that will come up in how to address them. Whether you may have to talk sternly to somebody, but it will come from that deeper, wise wisdom once you're doing it more in a way because you've understood, the situation better.
It may require discerning whether or not this is somebody capable of even having a discussion.
Yes.
And then also, am I ready?
Exactly.
Right?
Yeah. If it is going to frustrate you even more trying to explain, then it may be better off, trying to find a safe place,
Deleting that comment. Or not sending one.
Yes. Yeah.
You're saying we need to be compassionate, but we realize that they're not being compassionate, and then they're indifferent to that. And that's a real challenging thing.
Yes. Yeah. And that's why I think I've realized as I continue to go on my journey, and that's where I feel the mindfulness helps tremendously, because that's what mindfulness trains us to recognize that the other person is where they are. Where am I? Am I? Oh, I'm almost like I'm losing my temper, or recognizing that my voice is getting louder, or just recognizing that I'm frustrated. And then when we take a deep breath after recognizing, a lot of times it is valuable.
Am I ready to guide somebody who wants to take this path? That's it. Because they got to want to take the path.
Yeah, of course, it's always about, whether, anybody wants it, they want to receive it, all of these things. And I know that when I started my journey, I feel like I may have been a nagger because I was so excited. I thought that this was like a gold coin. How come people are not understanding that we should be doing that? There was enough. I had read China study, and I was just blown away. I think I was blowing the horn way too loud for people to receive it, right?
Mm-hmm. You thought everybody just needed the information and they would just do it.
And then I'm sure I turned a lot of people off, right, with that. So today when I reflect back, and today I would definitely say it's much more better to rather leading to be an example, because when we are leading to be example, you're just helping somebody to be curious. And I think that is far more easier way than, trying to change. Just letting people to be curious about why you're doing what you're doing. If they are curious, they'll ask the right question, and you may have, the excitement to share it. But if it's not coming from them and you're trying to give, it's not going to gel well.
One more thing on that, real quick.
And not that I'm perfect. I'm sure that
No.
I do indulge sometimes. Yeah.
I guess you're not really, you're not as much of an advocate as you are like a coach. Like you're a coach. So an advocate would be like, go out and try to galvanize people maybe. Whereas people come to you more so when they're ready, and you're going to coach them. Yeah. Right?
As a lifestyle coach, I think I have to respect whether they're ready, right? Yeah. And motivate them. There are different reasons. There are some people who are ready, but then they are, in a very difficult situation that they can change their lifestyle. So sometimes by just having these discussions, and a lot of times pointing out their strengths. And I think that is so valuable. People don't realize that they have amazing strength. They're so focused on their weaknesses that they're forgetting. And it is very rewarding when I'm able to point that out, that was them, that they showed up. They showed up for the appointment. I always say that's a big thing. And then taking baby steps. And that's why I love Atomic Habit. I think it's a genius how he's come up with, making tiny changes. Yeah. Because they have to last a long time. So that's another thing that we continue to encourage,
Like set a goal for 30 seconds instead of an hour. And that way you kind of get momentum, and then you...
Building it up. Doing it daily is the key, and what you're willing to do daily, right? So even if somebody is just willing to get up and like when they come, I'll say, okay, you tell me what you are willing to eat daily from the fruits and vegetables. And they'll pick a veggie. They'll say, okay, how about this? Do you think? I said, be realistic. And they'll pick, sometimes they'll just pick a certain quantity. I give them like a quantity. Like we come up, they come up with, whether 1 ounce leafy greens is good, 2, 3, they may come up with a number that they feel. I remember that brings me, I was working with somebody, and I said, how about you want to set a goal of having leafy greens daily? He was very excited. We'll do it. So I said, what number do you want to do? And he's like, I think 4 is good. 4 is really. And the next time when I met him, he's like, that was a lot. And the reason he had not realized, because he had not realized until they measured. So the drill was more that he had to measure it, and so then now he made the connection, what that 4 ounce looked like and how much was it chewing. And then I said, yeah, now you just set pace now that you know. He's like, but one good thing has come out is I eat every day the leafy green. Maybe I don't reach up to that amount, but every day it became. And I said, that's what, he figured out his strength. That his limit was probably 2 ounces was more, more realistic for him. And he knew that he had to build up. So I think that was very, exciting to hear from him.
That's cool, because a lot of times people say, oh, well, I tried to go vegan, but like it upset my stomach, I got gassy or something, and they didn't systematically work their way up to it.
A lot of people, when they start eating vegetables initially, not realizing that their microbiome has been messed up. And that's why, you have all these stomach GI issues. It takes time for it to...
Yeah. And even if you've been vegan for a long time, sometimes you can mess it up just traveling or getting off, a good disciplined routine, or overeating or eating too late. There's so many other variables.
Yeah. And the thing is, a lot of times, you may not eat as much as the fiber. It can be an eye-opener, that maybe I do need to add a little more fiber.
What would be an example of whole plant foods that are the least amount of fiber and most amount of fiber?
I have not measured in that way, and I'm not a nutritionist. So maybe something to look up.
When I was traveling last time, one of the things that came up with some of the advocates was more debate tactics, less coaching. It was more like, do you believe it's wrong to needlessly harm animals? That's what an advocate might ask somebody. And then somebody might say, well, yeah, I don't want to needlessly harm animals. And then that person might be ready. But if they say, yeah, I think it's totally fine to hurt animals, well, then that person
is not ready. Yeah, and there's no point in kind of, because now they're itself, they've already expressed.
Yeah. So with you, do you have any way of discerning who's a low-hanging fruit? One time somebody said the person who's going to be hardest to change, and this is like somebody trying to change people, would be somebody who doesn't care at all and doesn't have anything to say. Whereas somebody else might might talk a bunch of trash. That might be a good sign, actually.
When I have a conversation with a stranger, like let's say, one of the things in my journey is the least you talk about the food is easier, because I feel every person that you meet, they always feel they're expert in nutrition. It's not about judging, but it's that, the feeling that they sow. But if I do encounter listening to them, and if I'm asked a question, I will, as you said, but I wait more to be asked. At the end of the day, I'm avoiding to doing the advocation much less.
You're there as a professional coach to guide people once they're ready to take the path, essentially. Yeah, that's cool. I think a lot of people might prefer to do that than be an advocate. And I guess it starts with be the best you can be first, maybe, right?
Yeah, and as I said, I don't think I was like that. I personally feel, and I know I've
like
pushed
that
away.
As in what?
I think I was a big advocate
in the beginning, yeah.
In the beginning of my journey. And now I have just learned that, I have to put an oxygen mask on myself first and see what works for me, and focus. And being the example is going to always be far more easier.
What changed for you physiologically, mentally, or emotionally after you went vegan? Your husband shared a lot about his changes and needs physically. Did you have those kind of needs? Or?
Yeah, I think I had not realized until I started eating whole foods, mostly a lot more vegetables, because I was not eating that much. But once I started doing that, I could eat a lot more food than I had even imagined. And I was not gaining weight. Like, people think I'm very skinny, but when they see me eat, they're like, whoa, you do eat a lot. And I think that's the joy, right, of eating this way. A couple of weeks ago, a family member said, Asha, I have to tell you something. there's a glow. Every time we see there's the glow, there's energy. It felt good to hear that, but it made me realize, look, if we continue doing what we are, we will be able to tell people how energetic it is, So I think that's the big part. My family, there is history of heart disease. There is a history of diabetes in my family. I'm 60 now, and I've still not been touched by it yet. I'm not trying to brag about it, but I guess I'm more about learn the path of prevention. It's exciting to know that there is, whereas some people feel like they're destined to get the heart disease, they're destined to get the blood pressure, they're destined to get the diabetes.
It's normal, it's destiny.
Yeah, it's more destinies. I hear that, I can't help it. It's my genes. It's my genes. Makes me realize, I'm on that path and trying to learn that I could prevent it, and let's see if I can continue to be that way and prevent. So that is the other part that I preventing these diseases.
So you didn't really have any kind of issues when you initially did it 29 years ago?
No, because when people are young,
yeah, they're invincible.
And I'm sure if my daughter did not have these allergies, I don't think me and my husband, we would have waited for the heart attack that he would have had. Yeah. I think that would have been the eye-opener. Now, if I look back, right? Yeah. Because of the way, I don't think people realize that those heart attacks that are happening are preventable. We are grateful for, I'm sure, not that I wouldn't want that wish on anybody, because my daughter has to go through these, but overall I think it was a good eye-opener. So many of the Dr. Weiss's patients that I work with, in fact, a lot of times says, your sickness led you to our place, and
you treat it like it's a strength.
Yeah. Because they are taking ownership now, and now they're taking the action for it. And the results are remarkable. Yeah. The results are remarkable.
So it sounds like you enjoy the fact that you get to eat more food. You have great energy. You kept your teenage body. I threw that one in.
Yeah, actually the weight is, in fact, I'm better weight. I was a little heavier in my teenage, when I come back. Yeah.
And you've prevented getting chronic diseases. And I'm curious, you said it was in your family. How old are they typically when they get these diseases?
I think the onset is around 55, it starts creeping in. The diabetes is starting to creep in. Blood pressure is starting to creep in.
I know people way younger than that.
There are stents put in, some other family members. Uh-huh. So...
isn't it more like in your 40s when you start getting pre-diabetes?
Yes.
And even high blood pressure?
Absolutely. Yeah. It's only the pills start adding in the 50s. Yeah, but the signs are there. And that's why it's very rewarding to work with many who are open to exploring what all, possibilities and prevention path that we have to offer at my workplace.
What is your title at Ethos?
It's Lifestyle Clinical Director.
And people go there when they're already in a severe situation, or?
Mixed. I have mixed. People who have been turned down by the traditional system in the way for years and years they've been doing, but they continue to be on more medication. So those frustrated people do call us. Then there are people who want to be on the preventative path. And then there are a large number of people who are on set, now my doctor said I have to be on a cholesterol lowering medication. Now I have to be on blood pressure. So there is a lot of those. So it's goes from all.
The whole spectrum.
Yeah.
Cool. And then how can somebody learn more about Ethos and maybe get assistance from you or somebody like you there?
First of all, I always invite them, come to our open house. It's very important to hear Dr. Weiss. I think, when you learn from him, they'll be ready, right? Or if you're already ready, definitely go on our website. There is, a form that you fill in and we get notified. We call you, we send you the new patient paperwork, and then you're on a journey to work with us. Yeah. once we receive that paperwork and we schedule that appointment. Yep.
What's this open house? Is it like, how often does it happen, and what's that about?
I believe every other month. And then there is recently we started walk and talk.
Oh, cool.
Yeah, I feel like that was very,
with Ron,
great.
Right?
Yeah. Dr.
Is that
Weiss.
Is that on the property then?
At the property, they can go for a walk and talk.
Man,
So
they
would have to go to our website and check it out.
Do you have to book the walk and talk, or do you
It would be good, but it's free, right? So people are welcome.
They could just drop in without saying, "Hey, I'm coming."
It would be good to be, people can come. The timings are there, but we encourage them to register or at least there's a registration.
That's sweet. So you got the walk and talk, you got the open house, and these are ways to kind of get your feet wet, right?
Yes, yep. And the other way would be, if they don't want to contact us, then they should try our 2-week challenge. So that's another way to dabble, to see.
Is that something like
on
virtual?
The website? Yeah, it's an email that comes on daily basis. It's a self-driven 2-week challenge. So they can purchase it through our website.
And do they get a person to talk to as well, or is it
not for this 2-week challenge? No, it's a very self-driven. So it's more if they are motivated to diligently read those emails daily, only then I think it's valuable. But if they feel like they're not going to do that, they rather have a
human.
Yes. Then it's better that they pick up the phone and call us, and we would definitely discuss it with them.
And then is there like somebody there who's like on call, like an emergency situation, like I feel like I'm going to eat a cake or something, I don't know, or what kind of like staff or programs do you have beyond that, I guess?
So the way I would like to say is, we do have our new patient package, we call it. We feel like that's a very good way to get to know us, 2 visits with Dr. Weiss, 2 visits with a lifestyle coach, and 1 visit with a physical therapist. That whole gives like a picture, this is who I am, right? Because there'll be labs work done, there'll be an assessment done by the lifestyle coach, there'll be a FISNET evaluation done by the physical therapist. So once you receive that, you have an opportunity to decide if you wanted to continue to work with us. The way we work on long term. Dr. Weiss is very passionate about wanting to be a primary care doctor for his patients for a long time. He feels primary care is where you see that same doctor over and over, and that primary care doctor is the healthcare manager. That primary care doctor should be talking to the specialist. So, right now we have urgent care. We don't have like a primary care, it's dying. But he is relentlessly working hard to revive it. He feels that is truly going to get us the preventative path is through this setup. So when anybody goes through the new patient package, they have an opportunity then to roll into an annual based membership that they can continue to work with us. And when people are in our long-term programs, they have access to their lifestyle coach, hey, I can't resist this cake. I've had and the coach, and they will definitely have a discussion, and the coach will help them through in how to be able to minimize the assault that they are bringing on themselves, right? And helping them to recognize that, guiding them. We are the guide on the side, and then the beauty is Dr. Weiss is available also from the medical point of view to assess.
And does he create a meal plan generally?
All the coaches or the doctors that work, Dr. Weiss and the lifestyle coaches, they all prepare a care plan, is what we call, and those care plan have education material, stuff that that they are willing to do. Meal plan as such is more where we discuss with the patient and we kind of guide them, like as we tell them, as I was telling the example of that person who got motivated, oh, I'll take 4 ounces. Finally, he realized his limit was 2 or 3, you know. So because we are more guide on the side, we kind of strengthen the skills that they already have in what they are willing to commit to. If somebody who doesn't like to cook, we are kind of guiding them in how you can get away. Yeah. Then how simplicity could be just picking up fruits and vegetables, eating some frozen food, just steaming, or, you know, you could. And then that simplicity, that guidance, I think a lot of time helps them to get to their wellness goals.
Cool. And do you guys work on other behaviors as well, like exercise, sleep, things like that?
Oh yeah. So you know how you said earlier, 6 pillars of lifestyle medicine is from American College of Lifestyle Medicine. What Dr. Weiss has done is he's used these 6, but he's added a 7. So the way I tell when I have to work with his patients or a potential patient, that these are the 7 areas, you know, we kind of look into the food choices they make and understand and, you know, learn from that. Their fitness, sleep pattern, mindfulness practice, social connection, having clarity about whether harmful, you know, the harmful substances and the environment. Lastly, I feel that is so unique to Ethos is strengthening their connection to the natural world, the microbiome. And that's a big piece of health. So yeah, these are the 7 areas we work with.
That reminds me, like I added a 7th to it as well. I call it the hub. The 6 are like the spokes. And the hub for me is like self-love, like love, like just love. And love could be the social support, right?
Yeah.
Without that self-love, it's like you don't, or that social support, you don't have anything. So the community is really important. And I guess you guys probably address community too. And you have events like we're having this weekend, farm days, and you're doing the walk with Doc. So that's kind of community. So it sounds like you guys are, and that's a little exercise too, right? So you're addressing a lot of the pillars through that one location. It's amazing. I usually like to kind of get close to wrapping things up with a quote. Do you have a quote?
Oh boy, I have so many. I don't know whether I'm wording it correctly, but I always say we all have an opportunity for new beginnings. And it's there. So, you know, don't regret. You know, the day you realize that you have to make the change, that's the sign for new beginning.
It makes me think like, it doesn't matter how old you are either, right? Like, it's never too late. I was going to ask you this earlier, like what age ranges do you tend to see there?
We've had as young as, some of our program patients, children, you know, we see, but we've seen as young as 15 to 85. And I think there was one 90-year-old also that Dr. Weiss worked with. So that's the age range. But I think the middle range ones are a lot more. The younger ones are not as much because, as you said, they're invincible. They're not, you know, the older ones. I think a lot of times, I guess they probably are not yet ready, or they feel like they've given up a lot of times. So sometimes to encourage them that, no, you can start.
Is there anything that we didn't hit on that you would like to get out there? Or any last minute encouraging words, either one or both?
Yeah. I mean, the fact that if anybody does take the time to listen to my interview, to me, that is a big step. Yeah. That means there was curiosity they had. And I think if they continue with that curiosity and look into their personal, as I said, oxygen mask and evaluate, you know, assess, where am I on my journey, health-wise or, you know, emotional, any which way, and kind of, am I well? I guess from my coaching education, one of the things that I learned, wellness was far more powerful. It's not just about health, it's the wellness. So learning what that is for you and exploring. And
What's the difference between health and wellness?
I know it's very interchangeable, but to me, wellness accounts for, you know, physical aspect, mental aspect also. It kind of
The
gives
wellness is mental?
The whole component
Is health.
Is bundled up more of being well.
So you could be unhealthy and still well.
So that's what I'm saying. It's not possible. That's what I'm saying. It's what your view is. You know, how you're feeling on a bigger, you may be right. Like, you brought a good point. You know, somebody who may be eating, but
yeah, like if I have cancer, I can still have wellness.
No, I wouldn't say that. That's what I said. The physical aspect is important, right? Okay. So it's a combination. So wellness is a part where mentally you are able to be aware. It's not about, where you're aware about your anxieties, you're aware about your depression, and you're able to take an informed decision to act upon it. So overall, you are well-rounded in being aware to take actions for both
Sounds like mindfulness, though.
Yeah, I agree. And that's why it's built in. Yeah, mindfulness is more about just being aware, right? The physical aspect of the health doesn't combine with it. I feel you put it well, health and mindfulness, when it's combined, I think it turns into wellness.
I guess because you could be healthy and not be mindful and not on the right path toward wellness.
Yeah, exactly.
Or something.
Exactly. You could be mindful but not healthy. And you put those in. But I think when a person is striving or is on the journey, they understand both of these aspects pretty, they're aware.
Okay, so mindfulness and health are mutually exclusive, and wellness is when they're both together. Gotcha.
They are together. Yeah, it's almost they're integrated. And wellness is on a longer term basis, as I was saying, to reduce your morbidity period is because it is the consistent pattern of that energy and that, all of that mixed together.
You're making me think of how do you stay positive in such a sick world? I ask people that a lot of time, but I imagine you have a lot of support here, and you gravitate toward the light of wellness.
Yes,
toward the light of wellness.
No, you're so you definitely have a great way of articulation. That was always my weakness, but I would say because. It is, it can be depressing sometimes too, but I feel I'm more hopeful because from my journey in 1995 to now, look at the explosion.
I imagine though there was times where, it's been for me, I've only been doing this since 2011. There's been a lot of dark periods.
Oh yeah, frustration is there, anger is there, deprivation is there.
And it's not because we're vegan and have some deficit. It's because we're vegan and we're aware of what's going on.
Yeah.
Is that what you're talking about?
Yeah. You're aware of it, and recognizing all of those. I think once we are able to recognize all these emotions that we are, and you're not blaming somebody else for them, right? You're taking the ownership of, if I'm deprived, I'm taking the ownership why, or, if I feel depressed, I have to take the ownership of recognizing. Not that when I'm already depressed, I may not have the energy to figure it out, but I think that's where the mindfulness kind of state kind of helps you when you do consciously, take the opportunity to recognize, oh, I am depressed, and seeing what arises through those mindfulness practices.
Yeah.
And then you may need professional help or,
Yeah. You're talking about me?
No. No, I'm just saying we all need,
But I wonder if, which came first, Ron Weiss or your ability to gravitate toward mindfulness, because having the community support and all that.
It's so funny you ask me. I joined the MBSR, Mindfulness-Based Stress Reduction Program, in 2014. My program started, I had joined the program. It started in June or July, I vaguely don't remember. And I had interviewed Dr. Weiss the same period of time, and he was on the process of hiring me. And then he asked me, he said, have you heard about John Kabat-Zinn? And at that time, I'm like, not yet. Guess what? The course that I was taking, Mindfulness-Based Stress Reduction Program, has been designed by John Kabat-Zinn. I found out as I was becoming the teacher, right? My journey. But
Synchronicities are amazing.
yeah, it fascinates me. So both my journeys started simultaneously. I grew in both those places. I grew, my strengths continued as I continued to work with him, learn with him. He continued to train us. He continues to share his visions. So all of that, I think, strengthens and yeah.
And you put a lot of weight on your daughter being this catalyst, in the beginning and, with Furman and all. But surely it must go way back further than that. You being able to be receptive to that, there must have been.
That was beautifully put. When I reflect back, I think that was a big piece that we were, of course we were put in a difficult situation, but because I think one, you asked me, what is one of the big, suggestion? I always say, be open-minded and receive, don't be defensive when, there is information. Take time to kind of read through it and kind of digest and be open-minded. I think because of that, I was able to, because I was desperately looking. I do give a lot of credit to my husband's PhD in pharmacy because it strengthened our path.
Yeah, it might be a little challenging in this day and time because there's so much misinformation out there, and you're open-minded, and now you're getting garbage, So
you're so right. It's such a fine line, right, for that open-mindedness. So trying to decipher the right resources. Let's put it that way.
The right path. Yeah, and what's cool is like. I think that the totality of evidence makes it clear, things like what you guys are creating with Ron Weiss, this little blue zone area you're creating, essentially. We see it, the totality of evidence in so many forms that I think if you're really looking, if you're really genuinely inquisitive, you're going to find the right path. You're going to find your way through the misinformation. And the last thing, that I think would be really valuable to know is how can somebody else make this happen in their community? Like say they're like me out there living in this town where you're the only one who you feel like gets this and you're miserable because there is no community, there is no social support, and that's so important. Without that, it's almost like everything else is going to fail. Like you're not going to be able to sleep at night. You're probably not going to care about so many other aspects of healthy lifestyle. So how do you do that? Is it just meetups and try to go from there, potlucks? And
if you identify that you want that community to thrive, right? Like we have to identify it's a mixed, and if that is the role, then you would have to meet them where they are. If your neighborhood parties there and they're getting together, I think food brings people a lot together. And if you do take one of the there are so many amazing dishes nowadays, that people love. Like all of our friends and family, they love the desserts we make. They just love it. They're far more, they feel much better than the other ones. So I think once people start tasting that food they start becoming curious, and then the baby step starts.
It's the lure.
Yeah. So I would say that would be a good way without, of course you may have to carry your food, maybe there may be not food, much, but, being able to kind of connect in a compassionate way with them, not making it sound that your way is the right way, but more that, being the example then. Now somebody gets to know you. I know that in a lot of between our friends and family, a lot of times we do get calls when people start getting chronic issues and chronic, so, now they see, they'll try to bounce off discussions and all. So, that, it just happens. People notice. That's why they must be picking up the phone. They probably didn't talk to us before, but now, they face an issue. They're picking up the...
It's just so cool that there's something there, though. Like in a lot of towns, there's nothing there. So it needs to be created. What you guys are creating here needs to be replicated everywhere, really.
Yeah, and it'll happen. Look, in 1995, I was alone. Literally. There were hardly anybody. But I think overall, because within our family, we did it, I think I'm very grateful to both my children and, my husband, that we chugged along in this path. And I'm sure, there were difficulties that must have been faced. But it continued to go along, then the nutritarian, the online thing that Dr. Furman has, and then meeting Dr. Weiss, and, you're right. I was able to find that whole community, and I'm very grateful to the Ethos community. Now I feel like I've found, I've arrived. I'm at home. So that feeling is definitely there, versus as, being in a neighborhood where nobody's eating at all, which you are. So it can be a little difficult.
Yeah. I went to the grocery store earlier and it was so depressing. It's just like 99% of everything in there is just like, and you see people walking around oblivious. It's like, oh, it's so frustrating. And now, even though we're in proximity to Ethos, there's still a lot of work to be done around here, But this community has a lot to be grateful for, having y'all in the mix here. So
thank you.
I appreciate your time, and I look forward to seeing the magic happen this weekend at Farm Days.
Yes.
So I'm gonna let you go because I think you've been busy all day helping out, haven't you?
Yes.
Yeah. You do a lot of volunteer work too, or is it all paid? Or?
I do, because for Ethos Farm to Health, it's all volunteer.
Okay, yeah.
I definitely do give a lot of hours to Ethos Farm to Health also. Yeah.
Well, you're amazing, and your husband is too, and thank you for your time.
I appreciate that. Thank you.